How you doing? Good. Great. So, this is not a complicated issue. People want to make it complicated, and they think that we can't wrap our brains around it. So let me put a different twist on it. What did you think about the ACA as an organizing tool? Because we're for single payer, right? And we didn't get what we wanted. Congress is 50 times has voted to repeal it. But they can't make that work. And why are they working so hard to roll that back? Because once people have the notion that they should have insurance, then they want to say about what that means. And so what the ACA is a bunch of gobbledygook. It's managed care, and it's profiting for the insurance company and pharmaceutical industry. But what people understand is the concept that I should have insurance. And what's the purpose of insurance? It should protect me from going broke if I get sick. It should give me access to health care. It should be that I can walk in and get what I need when I need it without worrying about having to spend the rent. The ACA is an organizing tool. Because once you give it, you can't take it back. We can only get better. So that ship has sailed. The notion that people aren't entitled to health care, that's done. Because there are millions of people, more people, who believe that they're entitled to health insurance. So I'm the executive medical director for the Cook County Health and Hospital System. So I can tell you that in 2009, 56% of the patients in my beds were unfunded. 80% of the outpatients we saw were unfunded. Today, 70% of the patients we see are funded. Now, we understand that this coverage is like the hospital gown, right? It looks like it's pretty good in the front, but there's a lot hanging out in the back. There is nothing more powerful than physicians, nurses, and labor leaders standing together for one cause. That's a frightening thing to the establishment in this country. That's a frightening thing. And when I see this group tonight, I remember a song my father taught me called Joe Hill. I dreamt I saw Joe Hill this night, as live as you and me. Says I, but Joe, you're 10 years dead. I never died, says he. I never died, says he. I'm not going to burden you with the whole song, but it takes more than guns to kill a man. Says Joe, I didn't die. Joe says what they forgot to kill went on to organize. Went on to organize. And we are organized. We understand what's at stake. This is about the haves and the have-nots. We're talking about the 1% and the 99%. And we know what we want. And we know how to get it. So, they can keep trying to roll back the ACA. But the conversation is much simpler than that. And I'm not going to take a lot of your time tonight. It's been a long day. You have a lot tomorrow. But it's a very simple phrase. We uttered it today in front of Blue Cross Blue Shield. And I'm going to tell you, as I said, there's nothing more powerful. Physicians advocating for the care of their patients. Nurses advocating for the care of their patients. And the union standing with us because we all know what is at stake. Right? So what we want is everybody in and nobody out. Everybody in and nobody out. Everybody in, nobody out. Everybody in. What they forgot to kill went on to organize, and we're going to do it. Thank you.